And Dr. Timothy Quid joins us now with some of his secrets. Dr. Quid, thank you so much for joining us. Well, tell us, you talked to a patient who was upset because she regained all the weight that she had previously lost. So what happened in her case?
Well, this particular patient that I experienced about a week ago was a long-term patient. When I walked in the exam room, she had a lot of mixed emotions. She was angry, she was depressed, she was discouraged, she was even slightly tearful. But the bottom line was, she and I, we started a journey together about a year ago. And together we got 15 pounds off. We were on our way. But about a week ago, she came in and she had gained the weight back, all of it, and even gained an extra pound. And she told me she couldn't stick to the diet anymore. She was eating things she wasn't eating at first, and she just didn't understand why. And she was so concerned that she was a failure. And I just told her to stop. I said, it's not all your fault. I explained to her there are a lot of factors that are internal that are beyond our control, but I told her we have to continue to be positive.
And what exactly happens to a person to be more likely to regain the lost weight?
Well, those internal factors that I spoke of with my patient, I further explained to her, include certain hormones that are released from your stomach and other areas to include fat tissue. And as you lose weight, it's basically a result of our prehistoric evolution. In the prehistoric days, if someone was losing weight, there was a higher chance that they weren't getting enough food. So our bodies would release these hormones to make us very hungry. So we go out and chase the wildlife and kill it or work hard in the field, and we get the food up and gain our weight back. It's our body's way of equilibrium, keeping us alive with those survival tactics or those hormones. So as she was losing weight, her ghrelin level, which is one of those hormones released from the stomach, would go up. Her leptin would go down, which is another hormone, but she was becoming very hungry, and it was hard for her to stick to her diet. So she found herself overeating, and then she started getting a little depressed and discouraged. She stopped exercising, and she gained the weight back. But once I explained all that, she better understood that it was not all her fault, and we could fight this thing, and we can get back on track and get back on the road to health again.
So for those looking for a solution, what can be done?
Well, there are a lot of things that can be done. And I shared with my patient, and she was feeling more encouraged. I mean, one thing is get into an organized, structured weight loss program. And with this, you have a structured exercise regimen with support of others so they can encourage you, but also accountability. That is so important, to meet every week and discuss with the leadership of these programs that are very, very effective. And lastly, as far as the diet, not so much just a general diet, but a diet that's specific to what that person likes, meaning that you write down what you eat, you work with the dietary expert, and they customize it to work for you. And then lastly, I encouraged her. She was so excited. I'm actually studying for my weight loss examination, and I'm learning about a lot of FDA-approved medications that really work to help combat those internal factors like hormones and metabolism to help you get on a road to a healthier weight.
I need to learn more about that, Dr. Quid. I'm telling you what, the older I get, the more my metabolism slows down. It's just difficult to stay in a routine as well.
Welcome to the club, my friend.
Well, thank you, Dr. Quid, and we'll be right